Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. What to know about Hmpv as cases surge in China. Reports of a respiratory disease called human metapneumovirus, Hmpv, spreading in China have stoked fears and misinformation on social media. Some posts claim that this is a new virus and that China has declared a state of emergency due to a surge of Hmpv, influenza A, pneumonia, and COVID-19 cases. /r/n/r/n However, Hmpv is not new. It was first identified in 2001 and may have been circulating decades earlier, with recurring seasonal spikes in the winter, according to William Schaffner Maryland, an infectious disease specialist at Vanderbilt University School of Medicine. /r/n/r/n COVID-19 was an unknown virus while Hmpv is well known and occurs every year, Schaffner told Very Well. /r/n/r/n On January 7, the World Health Organization, WHO, stated that while there has been an increase in respiratory infections including in China, their rise is within the range expected for this time of year. The WHO said it's in contact with Chinese health officials and has not received any reports of unusual outbreak patterns. /r/n/r/n Schaffner explained that Hmpv is a respiratory infection similar to the flu, COVID, and respiratory syncytial virus, RSV, but most people have very mild symptoms and chalk it up to a bad cold. Symptoms of Hmpv may involve cough, congestion, fever, and shortness of breath, but severe cases may progress to a lower respiratory infection such as bronchitis or pneumonia. /r/n/r/n In most healthy people, Hmpv just resolves on its own. Unlike flu and COVID-19, there is not an antiviral medication that is effective for Hmpv, Schaffner said. /r/n/r/n Treatment generally involves rest, plenty of fluids, and over-the-counter medications like acetaminophen and ibuprofen to ease pain and fever. /r/n/r/n Symptoms can be more severe in children under 5 who may lack antibodies against Hmpv as well as in immunocompromised individuals and older adults. /r/n/r/n That's why if you get sick and aren't getting better, it's important to reach out to your healthcare provider to report your symptoms and discuss treatment, Schaffner said. /r/n/r/n If you have symptoms like sneezing, a runny or stuffy nose, coughing, or sore throat, you should stay home and rest even if you can't name the virus you might have, said Jodian Pinkney, MD, an infectious disease physician at Massachusetts General Hospital in Boston. /r/n/r/n Protect others by wearing a mask, washing your hands frequently, and covering your coughs, Pinkney said. /r/n/r/n In the United States, CDC data shows that 13,000 tests were conducted for Hmpv in December, but under 2% of the samples were positive. Right now, the number of cases in the US and elsewhere does not seem out of the margin of error of what's been happening year over year, but we are keeping an eye on the situation, Pinkney said. /r/n/r/n Human metapneumovirus, Hmpv, is not a new virus. It typically causes mild symptoms that resolve on their own. While Hmpv can be more severe in young children, older adults, and immunocompromised individuals, it generally doesn't require specialized treatment. To stay safe during respiratory virus season, practice good hygiene, wear a mask if you're unwell, and consult a healthcare provider if your symptoms persist or worsen. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.